So one of the biggest unmet needs is relapse disease. We are doing a pretty good job of getting people in remission the first time with intensive chemotherapy or with new novel agents in combination. The problem is that over time, most people will relapse, and that relapse will lead to their death. And so the question is, how, number one, do we prevent relapses, and how do we treat relapse disease? In terms of preventing relapses, we can look at how do we detect relapses earlier on. And the field is growing in what we call minimal residual disease or measurable residual disease. There are new technologies, both flow cytometry as well as PCR-based DNA assays looking at mutations to look for disease that may be undetectable by the human eye or not under microscopy, for example. Where if we detect even the minimal residual disease, how do we address that? We're looking at different ways of addressing that. One are monoclonal antibodies against minimal residual disease. Others are things like immune-based therapies, such as checkpoint inhibitors, to activate the patient's immune system to do surveillance and eradicate this minimal residual disease. And finally, to look at novel therapies in that minimal residual disease setting to eradicate that disease to prevent further relapses. So detection of the disease early on and then ways to act on that disease is a critical unmet need. I think there's going to be more advances in that space.